Before you do anything else, I want you to hold up one of your hands right now and look at it carefully. Not a quick glance, a real, deliberate look. Because in the next few minutes, I'm going to show you something that most people over 60 have never been told. Something that cardiologists observe every single day in clinical practice, but rarely take the time to explain to their patients. Your fingernails have been quietly recording what your heart and blood vessels are doing. They have been doing it your entire life. And if you know exactly what to look for, they can warn you about a cardiovascular crisis before it ever happens. I'm Dr. William Lee. I've spent years working with adults over 60 on preventative cardiovascular care, and something I see again and again genuinely troubles me. People come in after a heart attack or a stroke, and when I examine them closely, the warning signs were already written on their nails, sometimes months before the event, sometimes years. Nobody had noticed, nobody had told them what to look for. Before we go any further, if this kind of information is useful to you, hit the like button right now. It takes 1 second and it genuinely helps us reach people who need it. And drop your age in the comments, along with whether anyone in your family has experienced a heart attack or stroke. I read every comment personally, and your answers shape what I cover next. That ends today. Stay with me until the very end, because the last sign I cover is the one that shocks people most. Why your nails carry this information. Your nails grow from a structure called the nail matrix, sitting just beneath the base of each nail. The cells in the matrix are in direct, constant contact with your bloodstream, nourished by the tiniest blood vessels in your entire body, the capillaries running beneath your nail bed. Because those vessels are so extraordinarily fine, they are among the very first structures to show stress when your cardiovascular system begins to struggle. Think of your nails as a live monitor your body has been running quietly every single day. After 60, this matters even more. In your 30s and 40s, your heart can quietly compensate for early dysfunction for years without anything visible appearing. After 60, those reserves are thinner. Warning signals begin appearing earlier, and your nails are often where they surface first. A typical 15-minute medical appointment cannot cover everything, and nail examination rarely makes the priority list unless something is dramatically obvious. The information exists in the medical research. It simply never reaches the person sitting at home who actually needs it. That gap is exactly what I am here to close. Sign 1. Terry's nails. The first sign is called Terry's nails. This is not a term most people have encountered, but once you know it, you will look at every pair of hands differently. Terry's nails occur when the entire surface of the nail takes on an opaque whitish or very pale appearance, almost like frosted glass, with one defining feature at the very tip, a narrow strip of pink or reddish color at the far edge of the nail, usually just a few millimeters wide. That strip at the tip is what separates Terry's nails from ordinary pale nails. Look for it specifically. Research published in Cardiovascular Medicine has identified Terry's nails as significantly associated with coronary artery disease, heart failure, and diabetes. One study found that people with Terry's nails had an odds ratio of over 6 for coronary artery disease compared to those without them. That is not a minor statistical footnote. It is a major signal. And every condition linked to Terry's nails shares one characteristic. It develops slowly and silently over years before anything dramatic happens. A patient I'll call Robert came to see me at 71 with no dramatic complaints. He felt reasonably well, but had been more fatigued than usual, something he naturally attributed to age. During the examination, I noticed his nails were unusually pale, with that characteristic reddish strip at the tip. I asked careful questions and ordered an echocardiogram. The result revealed early-stage heart failure that had been developing for close to 2 years without any obvious symptoms. Robert is doing very well today. He received the right treatment at the right time. His nails opened the conversation that made that possible. Sign 2. Lindsay's nails. The second second sign is called Lindsay's nails, sometimes referred to as half and half nails, and the appearance is distinctive enough that you will recognize it immediately once you know what to look for. The nail is divided into two clearly visible zones. The half closest to your cuticle is white or very pale. The half closest to the tip is a brownish red color. The dividing line between the two zones is usually sharp and clear. Lindsay's nails have been associated in clinical research with heart failure and liver cirrhosis, and they tend to appear after the body has been under sustained circulatory stress for an extended period. Both Terry's nails and Lindsay's nails are disorders of nail bed color, and both reflect how effectively blood is reaching and nourishing the smallest tissues in your body. When circulation to the fingertips is compromised over a sustained period, the nail bed loses its normal, healthy pink color and begins displaying these altered patterns instead. Both signs are visible in ordinary daylight without any equipment. Hold your hand under good natural light right now and look carefully at each nail. You can check for both of these signs in under 30 seconds. Do it while the descriptions are still fresh. Sign 3, Merkey's lines. The third sign is called Merkey's lines, multiple horizontal white lines running across the nail, parallel to the lunula, which is the small crescent-shaped pale area at the base of your nail. Merkey's lines do not feel raised when you run your finger across them. You can see them clearly, but you cannot feel them. This is one of the key details that distinguishes them from other types of nail ridging. They are a visual signal, not a textural one. What makes Merkey's lines particularly significant is the research behind them. A study examining the relationship between nail findings and cardiovascular disease found that Merkey's lines were a statistically significant predictor of heart failure with an odds ratio approaching 6. The underlying reason is that these lines reflect low albumin levels in the blood, a marker of the body being under prolonged nutritional and circulatory stress. When the heart is struggling to circulate blood efficiently, the rest of the body begins to feel the consequences. A patient I'll call Catherine came to see me at 68. She was active, not overweight, and genuinely felt fine. During the visit, she mentioned, almost as an aside, that she had noticed some horizontal lines on her nails over the past few months and assumed it was probably nothing. I looked carefully and recognized Merkey's lines across several fingers. A cardiovascular workup revealed early heart failure, entirely manageable at that stage. The lines had been appearing for months. Her body had been quietly asking for attention. Sign 4, Bow's lines. The fourth sign tells a very different story from the others. Where most nail signs build gradually and reflect chronic conditions, Bow's lines appear in response to a specific event. Bow's lines are horizontal grooves or depressions running across the nail plate. They appear because when the body undergoes a significant physiological shock, a heart attack, cardiac surgery, a severe infection, or any major health crisis, the nail matrix briefly stops producing new nail tissue. When growth resumes, the pause leaves a groove behind. Over time, that groove grows out toward the tip of the nail, and its position along the nail can actually help estimate when the event occurred. What makes Bow's lines clinically important is that they can reveal a past cardiac event that the patient themselves never recognized. Silent heart attacks are more common than most people realize, particularly in older adults, where the classic dramatic symptoms are frequently absent. A patient I'll call Harold came in for something entirely unrelated. I noticed a clear horizontal groove across nearly all of his fingernails. I asked about it, and after reflection, he recalled being seriously unwell about 4 months earlier with what he had assumed was an unusually severe flu. Testing revealed he had experienced a silent heart attack during that illness. His Bow's lines told the story his symptoms never had. Sign 5, Splinter hemorrhages. Now I want to direct your attention to something you look for underneath the nail surface rather than on top of it. These are called splinter hemorrhages, and they look exactly as the name suggests. tiny, dark splinters or thin, dark lines running vertically beneath the nail. They are small collections of blood trapped in the nail bed capillaries. A single splinter hemorrhage following physical trauma to the hand is nothing concerning. Multiple unexplained splinter hemorrhages across several fingers is an entirely different matter. In medical training, unexplained splinter hemorrhages across multiple nails are classically associated with infective endocarditis, an infection of the inner lining of the heart's chambers and valves. This condition develops when bacteria enter the bloodstream and attach to damaged heart tissue. The infection causes tiny clots to break off and travel to distant blood vessels, including the minute ones in your nail bed. Infective endocarditis is serious and requires urgent medical attention. A patient I'll call Francis noticed these dark lines on several nails and mentioned them to me almost as an afterthought during an appointment focused on something else. She was diagnosed with a heart valve infection that was caught in time to treat effectively. She told me afterward that she had almost not mentioned it at all because she assumed it was nothing. Sign 6. Lunula color changes. The small whitish crescent at the base of each nail is called the lunula. Most people think of it as simply a cosmetic feature of the nail. It is actually the visible portion of your nail matrix, the active zone, where new nail cells are being continuously formed. And the color of your lunula is one of the most overlooked diagnostic signals on the entire body. A reddish lunula has been significantly associated in research with valvular heart disease and congestive heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation, similar to the cyanosis seen in more advanced cardiovascular disease. A lunula that has faded to almost nothing or become very pale is often a sign of anemia. And anemia places direct strain on the cardiovascular system because an anemic heart must work significantly harder to compensate for reduced oxygen carrying capacity in the blood. All three of these color changes deserve medical attention. A patient I'll call Dorothy was 74 years old when her daughter, who happened to be a nurse, noticed during a family visit that the half-moon shapes on Dorothy's nails had almost entirely disappeared. Dorothy had not noticed the change because it had been happening so gradually. She'd been looking at those same nails every day and had simply adjusted to the new normal without registering that anything had shifted. Her daughter encouraged her to raise it at her next appointment. A complete blood count and cardiovascular workup revealed significant anemia and early cardiovascular strain. Both were caught and treated before anything serious developed. The capillary refill test. Do this right now. I want to teach you a test you can perform on yourself immediately using nothing but your hands. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover from pressure. Here's how you do it. Hold your hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for approximately 2 seconds. You will see the nail bed go pale as blood is pushed out. Then release the pressure and begin counting quietly. In a healthy adult with good circulation, the pink color returns to the nail bed in under 2 seconds. If it takes 3 seconds or longer, and you get the same slow result when you test 3 or 4 different fingers, that is a meaningful indication that your microvascular circulation is sluggish. Research has linked persistent, slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. A patient I'll call William tried this test one evening and counted nearly 5 seconds before the color returned to his index finger. He tested his thumb, then his middle finger, then the fingers on his other hand. The same slow result every time. He called my office the following morning and described exactly what he had observed. A full workup revealed undiagnosed atrial fibrillation, one of the most common and dangerous causes of stroke, in adults over 60. He was placed on appropriate treatment and, based on everything current cardiology literature tells us, that phone call very likely prevented a major stroke within the following year. He had no other symptoms at the time. None. Your practical framework, starting today. Take both hands to a window in good natural daylight. Look at each nail one at a time and work through the following checklist. Check the color of the nail bed for any bluish, purplish, or unusual pallor. Look at the tip of each nail for that characteristic reddish band that signals Terry's nails. Look for the sharp two-tone division that signals Lindsay's nails. Look for horizontal white lines across the nail that you can see but cannot feel, Mierke's lines. Check for any deep horizontal grooves, Bow's lines. Look for tiny dark lines beneath the nail surface appearing without any trauma history. Examine the base of each nail for the lunula and notice its color and whether it is shrinking. Then perform the capillary refill test on at least 3 fingers and count the seconds honestly. Write down what you find. This step matters more than most people realize. These changes are slow and gradual, and human memory is notoriously unreliable across months. Take a photograph of your hands in natural light today. That image gives you something concrete and honest to compare against 6 months from now. If you observe one of these signs, mention it at your next routine appointment. If you observe 2 or more signs together, do not wait for your annual checkup. Call your doctor's office this week, describe what you observed, and ask whether you should be evaluated sooner. Before I close, if what you have read today has given you something you did not have before, please subscribe to this channel and share this with someone you care about, a parent, a sibling, a friend who has mentioned heart concerns, or who you know is over 60 and not paying close attention to their health. You do not know whose life this information might change. Share it now, not later. One final thing. Please do not use any of this to diagnose yourself. What these signs do is give you a specific, informed reason to have a conversation with your doctor. The full clinical picture, your history, your medications, your other symptoms, is what produces an accurate diagnosis. Your job is not to diagnose. Your job is to notice, to document, and to speak up. That is the part most people never do, and it is the part that makes all the difference. Your nails have been sitting at the end of your fingers your entire life. They've been taking notes every single day about how your blood is moving, how your heart is working, and what your smallest blood vessels are doing. The only thing that was missing was someone telling you how to read what they have been recording. You now have that. Use it.